Welcome to the Personal Foot Care Education Programme, Sections 1 to 5. This has been developed by the Scottish Government Personal Foot Care Working Group. If you have any questions during this presentation, please put them in the chat and we will stop for opportunity to review these and answer any questions. This education programme contains 8 sections. What is personal foot care? Keeping feet clean, skin care and checking feet, footwear, what to do if you spot a problem, nail cutting and filing, nail conditions, and at the end there'll be the opportunity to ask questions. By the end of this programme, you should be able to explain the importance of good personal foot care, clip and file toenails safely, recognise why feet need to be checked on a regular basis, explain the importance of good skin care, describe the correct features of good fitting footwear, and be aware of the referral criteria to your local podiatry service. Personal foot care is part of personal hygiene, such as shaving, bathing, etc. You can do a lot to help keep the feet of someone you are caring for in good condition. Having your feet in good working order is important no matter what age you are. There is research to show that good foot care can help in the prevention of falls. Well cared for feet can improve comfort, mobility, confidence and independence and have an impact on your overall quality of life. These are the tools that you will need to cut and file toenails: nail clippers, nippers, and a nail file or emery board. Prevention of cross-infection or spread of germs is very important, and this is why every person should have their own personal nail clippers and file and keep them for their own use only. You can find an order form for these items in your handouts. It is a good idea to keep a person's foot care items in a plastic box or zipped plastic bag to keep them all together. It's a personal preference whether you cut or file the nails. Please see the following video clip about the toolkit.
The tools that you will need to cut and file toenails are nail clippers and a nail file or emery board. It's a personal preference whether someone likes their toenails cut or filed. When cutting and filing someone else's nails, you will firstly need their permission to do this and ask what they prefer. Also, it's important to wash and dry your hands before you start and when you finish. Remember that preventing the spread of germs is very important, and this is why they should have their own personal nail clippers and file and keep them for their use only.
Here are some things that you might like to include in a personal foot care kit. There are some nail clippers, a range of emery boards, they all do pretty much the same thing, and also a foot file. You might find it helpful to keep these things together, either in a plastic box or in a sealed plastic bag.
It may not be suitable for you to provide foot care to people with the following conditions. Advice should be sought in this situation. Poor circulation, often seen by the colour of the foot, and may lead to an increased risk of ulceration and infection. Certain medications, including blood thinners or steroids, can lead to an increased difficulty in stopping bleeding once the skin is broken. Steroids may lead to thinning of the skin or difficulties in healing. In some people with diabetes, the feet may be at increased risk due to reduced circulation or sensation, leading to an increased risk of infection. Some skin and nail conditions can be difficult to treat. These will be covered later in the programme. Briefly, any nail that you would find difficulty in cutting safely. Sometimes the shape of someone's toes or foot deformities may make it difficult to carry out personal foot care. For example, if they have severe arthritic joints. If you're in any doubt, please contact Podiatry. It is really important that feet are kept clean to prevent infections. Please see the following video on keeping feet clean.
Keeping feet clean. Wash their feet every day if you can. If they are unable to get into the shower or bath regularly, it may be easier to wash their feet using a plastic basin. Before you start, make sure you have everything you need beside you. Some mild soap, a soft brush such as a nail brush, and a clean dry towel. Fill the basin half full of warm water. Get them to sit comfortably in a chair and place both their feet in the water. Use the soap to lather up and clean all areas of the feet, making sure you get in between their toes. Use the soft brush to rub over their nails. Try not to soak their feet for too long. No more than 10 minutes is the rule, otherwise you will dry out the skin. Dry both feet carefully, taking care to pat dry in between their toes. If you find it difficult to dry in between their toes, you could try using cotton buds or folded cotton wool pads.
It is important to wash and dry well between the toes. This can be a challenge where people are living with dementia or there are behavioural problems. Check feet morning and night if possible, but at least daily so problems are picked up quickly. Remember, where there are communication difficulties, someone cannot tell you when something is wrong. Overlying toes are common, especially in an older person. Toes can be stiff and difficult to separate. In these circumstances, thin wipes or cotton buds can be used to clean between the toes. Pressure may develop with overlying toes. Excessive pressure may cause redness or a build-up of hard skin, which can lead to ulcers and infection. Skin becomes dry with age, especially around the heels. A moisturiser should be applied daily. Please do not use moisturiser between the toes, as this may encourage the skin to break down or cause fungal infections. Heel sores. Pressure injuries may develop in the bedbound or in those with poor mobility. Therefore, it is important to check heels daily and report any concerns immediately. Early signs include redness or discoloration, non-blanching erythema, which is when the redness doesn't go away when it's pressed. A later sign is blistering and requires urgent attention from a healthcare professional. Corns and thickened skin should be filed gently every week using a foot file, followed by a moisturiser to keep the skin soft. Corns may develop as a result of pressure from footwear. Therefore, footwear may need to be changed. Thickened skin is sometimes the body's way of protecting you and does not always cause pain. It is important to remember that people living with dementia may not complain of pain despite a large build-up of hard skin. If the development of hard skin appears excessive, please refer to the Podiatry Department. Painful corns should also be referred. Corns between the toes can also be caused by footwear that is too tight or too loose. It is not always possible to file this type of corn. A change in footwear is essential to help cure these. Soft corns may develop if the skin is moist, therefore no moisturiser should be used between the toes. Anhydrosis or dry skin can result from too little sweat being secreted onto the skin or from the person being dehydrated. This causes the skin to become more prone to cracking or fissuring. Little more can be done than to apply emollients daily to try and restore the skin's normal water content and encourage the patient to drink more fluids. Try using a urea-based emollient to rehydrate the skin. Cracked heels are the main complication of dry skin. This occurs as the skin is less flexible and more prone to pressure around the heel area. Hyperhidrosis or moist skin results from too much sweat, causing the skin's water content to be high. This can also be caused from the feet being enclosed in wet, damp conditions, for example, incontinence. This affects the strength of the skin and can lead to moist fissures or cracks, especially between the toes. Athlete's foot or fungal infection is a complication of moist skin. It most often occurs between the toes where the skin has developed moist fissures and so allowing a fungus to enter. Good hygiene helps prevent athlete's foot. Athlete's foot may cause itching between the toes. It is easily treatable with antifungal creams or powders, which are available as over-the-counter preparations or on prescription. To prevent athlete's foot, clean socks or tights should be worn daily. Well-fitting footwear is very important to prevent problems developing with feet and in reducing the risk of falls. The more mobile the person is, the more important it is to have supportive footwear. Shoes should be used where possible. They should have a lace or strap to securely hold the foot when walking, and good width and depth to prevent pressures on the toes. To avoid foot problems, always ensure footwear is fastened and the appropriate size used. Incorrect footwear is a risk factor for falls. Man-made fibres such as nylon do not allow moisture to evaporate from the feet. For socks, cotton is cooler in the summer and wool is warmer in the winter. To avoid foot problems, always ensure footwear is fastened and the appropriate size used. Check footwear for fit. These slippers pictured are more supportive than ordinary slip-on slippers. This is the preferred option for people that are mobile and prefer to wear slippers. Ask the podiatrist for further details if needed. Slippers may be used for shorter periods when the person is less mobile. If chair-bound, a soft slipper or sock is all that is required to keep the feet warm. Before putting footwear on, please check for foreign objects. It is not unusual to find items like sweets and tissues in the toe area. Sloppy, worn slippers are a falls risk. Ensure that the back of the footwear is not flattened. Slip-on shoes or slippers can cause the foot to slide forward, causing the toes to curl up, which can result in nail problems, friction, pressure lesions, such as corn or callus on the tops of the toes. Emergency referrals are prioritised. Infection is classed as an emergency and should be referred to the podiatrist immediately. The image demonstrates an ingrowing toenail. This can be the result of cutting nails too short or down at the sides. As you can see, infection is present, resulting in inflammation and swelling in the toe. The high-risk foot. These are examples of more extreme high-risk feet where the circulation or healing is very impaired. These would require immediate referral to possibly A&E, podiatry services or the GP. Neglected nails are not an emergency. However, please refer to the podiatry service. Once the nails have been reduced to a manageable length, they may well be suitable for personal foot care.
Welcome to the second part of the education programme for personal foot care. The contents of this programme contain nail cutting and filing, nail conditions, and frequently asked questions. As this is personal nail care, the need for privacy and dignity being afforded to each person should be understood. Consent should be sought verbally on each occasion, and if not granted, this must be regarded as non-consent and treatment must stop. Where a person is unable to verbally consent and obtained adults with incapacity, consent should be held on record within the care home or organisation. Remember about hand washing. The most common way germs are spread is via people's hands. Safe environment includes seating position, good light, avoiding stooping and bending where possible. Use 2 chairs or stools of similar height. If feet are not newly washed, then wipe them over and between toes with a moist skin wipe. Sit comfortably facing the person and place a paper towel on your lap. Lift and raise the person's foot onto this. If possible, have the light source from a window or lamp shining on the person's feet. If the person is unable to raise their leg onto your lap, it may be easier if they sit on their bed with their legs outstretched, with you sitting on a chair or stool at the end of the bed. The nail is a hard plate made of a tough protein called keratin that covers the tips of the fingers and toes. Its main function is to protect and provide sensory information. The nail grows at a rate determined by the matrix. Toenails tend to grow slower than fingernails. Total replacement of a toenail takes 12 to 18 months compared to around 6 months for a fingernail. The arrow shows the direction for filing away from the body. To cut nails, make several small clips on the nail with the tip of the nail clippers or nippers. Cut the nails following their natural shape. Aim to have the final length of the nail just below the tip of each toe. Avoid cutting down the sides of nails, as this can leave the surrounding skin uncomfortable. Filing nails once a week will keep the nails at a reasonable length. Cutting toenails, if right-handed, use left hand to hold the toe, and with the left thumb add tension to the pulp of the toe, pulling the tip of the toe down away from the nail plate. Check for vascular skin tufts under the nail plate. Vascular tufts are a group of blood vessels contained in skin under the nail. We will now show you a video on cutting toenails.
Cut nails make several small clips or nibbles on the nail with the tip of the nail clippers. Cut the nails following their natural shape. Aim to have the final length of the nail just below the tip of each toe. Avoid cutting down the sides of nails, as this can leave the surrounding skin uncomfortable. When you're finished, wash your hands and dispose of the nail clippings.
Filing toenails. Remove any rough edges using the nail file or emery board. File the nails in a direction away from the ankle or in a sideways motion from the sides to the centre of each nail. Thickened nails should be filed in the length and the thickness. It is easier to file toenails when they are dry. Never file up against the nail edge, as the nail can be lifted from the nail bed. Filing nails once a week will keep the nails at a reasonable length.
Filing toenails. The person you are caring for may prefer to have their nails filed, and this will avoid the need to clip the nails. Filing nails once a week will keep them at a reasonable length. It's easier to file nails when they are dry. File the nails in the direction away from the ankle or in a sideways motion from the sides to the centre of each nail. Thickened nails should be filed in the length and the thickness. When you're finished, wash your hands and dispose of the nail clippings.
If you have a bleeding area in any of the nails that you are treating, adopt regular first aid procedures. Apply pressure to stop bleeding. Apply sterile plaster or dressing. Keep plaster or dressing on for no more than 2 days, after which the area should be checked. Record on the patient's care plan and contact podiatry or the person's GP if you're concerned. Nail conditions. Some people may only have one abnormal thickened nail and would therefore fall into the shared care approach, where the podiatrist or podiatry assistant would manage the difficult nail and the carer would manage the others. This slide illustrates some examples where shared care would be probable. Image 1, thickened and misshaped, can cause problems down the side of the nail and get pressure from footwear. With poor circulation, there is a greater risk of ulceration that may not heal. Ingrown or involuted nails can puncture the skin and get infected, and fungal nails will look discoloured and can cause discomfort due to the thickening and change in its shape. Take a moment to think about what you would do if you were presented with any of these. Challenging toenails. Although the examples in the previous slide look serious, after initial assessment by podiatrists, personal foot care may thereafter be able to be managed by the carer. What sort of questions do you have about how to manage foot care? We will give you a minute to think and put your questions into the chat, or if you're watching the recording, write it down on a piece of paper. These are just examples of questions we have been asked in the past. When should we cut nails? It's often easier to cut nails after a bath. How often do we cut them? As often as required. It will vary from person to person. What if they are too hard? Often after a bath, nails should be soft enough. However, in some cases, it may require that the podiatry assistant thins down the nails occasionally. Can we use scissors to cut toenails? Yes, you can. Nail nippers are best for this type of care, and when shown how to use them safely, you will find them easier than using scissors. How do we know whose nails to cut and whose not to? The exclusion criteria detailed at section 2, poor blood supply, screening as high risk diabetes, numbness, rheumatoid arthritis, etc. If in doubt, contact your local podiatry department. What to do if redness, pain, swelling or pus is evident? Refer anything urgent to podiatry services. Please, if left for too long, potential for more severe consequences to develop. Why doesn't the podiatrist cut toenails? Looking after toenails is something that most people can do for themselves and is part of personal care. Podiatrists have specialist skills in the prevention, diagnosis and treatment of a wide range of abnormal conditions that affect the feet and lower limb. Where can I buy foot care equipment? Nail clippers and files can be bought from the high street stores, online or local pharmacies. Cardboard, polystyrene or metal files are all suitable, and there is a list of things that you can purchase in your handout. The learning outcomes. By the end of this programme now, you should be able to explain the importance of good personal foot care, clip and file toenails safely, recognise why feet need to be checked on a regular basis, explain the importance of good skin care, describe the correct features of good fitting footwear, and be aware of the referral criteria to the local NHS Podiatry service and recognise when to make a referral. Here are a list of local contact details for your local podiatry department. You can check their website, you can telephone them in the above number or email them at wipodiatry@nhs.scot. For further information, you can visit the Royal College of Podiatry, AIDS Scotland UK and Diabetes UK. Thank you so much for attending.